Welcome, everyone. My name's Wendy Trevathan, and you're listening to Your Nurse Voice Matters. And I have the beautiful Sandi Hadden with me today, who I have known for a few years now, and I was really excited to have Sandi come in today. How are you, Sandi?
I'm really well. Thank you, Wendy. It's good to see you.
Yeah, good to see you too. We've just had a minute to catch up on a few things, and it's one of the things that I really enjoy about this podcast is I get to see old friends. It's good.
Yeah.
Excellent. All right. So I know Sandi pretty well, but our viewers and listeners don't know her. So let me do Sandi's formal introduction. So Sandi Hadden trained at the Royal Children's Hospital in Melbourne in 1984 and began her career in general medical nursing roles before transitioning into oncology. During her time in oncology, Sandi encountered patients who, after undergoing cancer treatment, returned to the hospital for end-of-life care. This experience profoundly impacted her and sparked her interest in pursuing a career in palliative care. Determined to follow this path, Sandi literally knocked on doors until she secured a position as a registered nurse in a dedicated palliative care unit in Melbourne. Eventually, life led her to Queensland, where she continued her work in community palliative care, and that's where we met. It was there that she discovered her true niche. By this stage in her career, Sandi had completed her postgraduate certificates in palliative care and aged care. Seeking to expand her skills, she took on a role as a director of nursing at an aged care facility to gain valuable management experience. However, she felt the pull to do more. While working once again in community palliative care, Sandi collaborated with a nurse practitioner who, after handover one day, asked why she wasn't pursuing a nurse practitioner position herself. I know exactly who that was. That conversation ignited a new ambition, and in 2015, Sandi set out on a mission to achieve nurse practitioner endorsement. Life eventually brought her back to Victoria, where she realised her goal. Today, Sandi Hadden is an endorsed nurse practitioner specialising in aged and palliative care. She currently serves in this capacity with Grampians Health, where she continues to make a meaningful impact in her field. So firstly, formally, congratulations on achieving a dream that I saw start and
Thank you.
that you followed through and actually completed that. It's very exciting.
Mm. Yeah, it
Yes.
was. It was a big undertaking, especially as an older nurse. But yeah, look, it's been the best thing I've done.
Yeah.
Yeah.
Awesome. And I'm sure you're making a huge impact. So let me turn the tables back about
Yes.
when you decided to become a nurse. Can you reflect on that time and share with the audience about what actually prompted you to become a nurse? Was there
In the
something that
first
happened?
place.
Yeah.
Look, my grandmother was a nurse,
Mm.
and she was a matron, and so I used to, as a little tacker, I used to go to work with her, and she used to take me on her ward rounds. And back in those days, all the patients had to be in bed and tucked in and presentable for the doctors. And she would lead me along and pop me on the bed with all the patients when she was talking to the doctors. And I just wanted to be a nurse ever since I was really little. I used to run around with a red cape on and a hat, and yeah, anyone that came near me, I was bandaging them or uh, yeah, doing something like
They were
that.
fair game, were they?
Yeah, so there was never any other career that I inspired to be. My grandmother, as I said, my nan, she was the most amazing person. She told me some amazing stories about her nursing, and it just prompted me to want to follow in her footsteps.
Wow,
Mm.
that's really inspiring. I didn't have any nurses in my family apart from my big sister who had just finished her
Mm.
training. And
Mm.
yeah, that kind of led me down there and personal situation with dad, which I'm sure you may have heard that story of
Mm.
mine. Yeah,
Yeah.
definitely. So, and I mean, you've actually circled back to where it all started, really, for you, and
Yes.
you've done the tour of Australia, really, to achieve your goal.
Yeah.
What's been the highlight of your nursing career to date? What sort of any sort of experience or moment or situation that has stood out for you?
well, besides getting endorsed as a nurse practitioner,
Mm,
when I came back to Victoria, it was around the time that the Voluntary Assisted Dying Act was being debated in Victoria,
mm,
and the legislation was being passed. And I was at that time a conscientious objector, and I was working in community palliative care, and a patient asked me if I could be with him while he took the medication. And it just completely, I automatically said yes because, patient first. And it really turned my whole world around, actually. And so I became, after that experience, which was quite profound, I became quite an advocate for voluntary assisted dying in Victoria and did a lot of work in that area, including making a documentary about how to access the legislation in Victoria. So I was very proud of that body of work that I was able to do. Yeah.
was this around the time where the movement was very big in the Northern Territory? Was that in around the same
No, it was
time?
after that. It
It
was
was
after
after
that.
that.
Yeah, yeah.
Yeah, yeah.
Mm.
Okay. And like advocating for that, nurses want the best by their
Mm.
clients and patients,
Mm.
and to make sure that they're comfortable and to have their wishes.
Exactly.
I remember doing the advanced care planning when that first started up in North
Mm.
Queensland, and there was a lot of controversial around that, and a lot
Mm.
of patriarchal thoughts, particularly in
Yeah.
the medical profession.
Mm.
Was there any sort of barriers that you came across during that
Absolutely.
time? Yes.
Absolutely. And I respect other people's right to be a conscientious objector.
Mm,
But in the palliative care circles that I was working with, there was a lot of feedback from doctors that I was doing the wrong thing, and um, it was very difficult to be able to help patients that needed help because there were
mm,
barriers to them. So I think it's a little bit different now because it was new legislation. But even at that time, Palliative Care Australia didn't support the right to choice. So things have changed significantly, and obviously voluntary assisted dying has come in every state now.
mm.
Um, but at the time, it was I had a lot of personal kickback from medical fraternity in palliative.
Yes. Yeah.
Mm.
Lots of debates, lots of
Yeah,
discussion, and
yeah,
yeah.
and all that's fine, but it
Yes.
became quite personal, and
Yes.
so I really had to have a really good think about what I was doing.
Yes. Yes.
But as a nurse, you do put your patient first. It's not about us. It's about the patient. So,
Yes. Yes. Um,
mm,
without disclosing or anything, obviously we're not doing that, but what was the family's role in all of that decision making? Can you tell the audience? Because sometimes the
yeah,
patients, yes, we can understand they're wanting
mm-hmm.
to do this, but I can
Mm,
imagine, and I've been in the situation with the family dynamics, that
mm,
there is usually a difference of opinion with the family members. Can
mm-hmm.
you describe like some of the
Yep,
scenarios that you would have come
absolutely. There's
across? Yeah.
it leaves it's a very difficult situation when you've got a family member or a carer that doesn't agree. But majority of times, the family have always put their loved one first,
Mm,
and even though they might not agree with it, um, because they love them, they've come around to letting it happen. But there has been a couple of occasions that families have stopped that choice,
mm,
and that's been quite distressing because then this patient that's making this choice about their own life has had to continue on and really suffer in their
mm,
end of life care. And that's been really difficult to provide that care when you know that there's this disparity in the family. And but it's our job to look after not just the person, but the whole family, and
mm.
can't sort of get involved in that. You've got to just provide the care.
Mm.
Yeah. So,
It's like being a facilitator
mm,
for education and supporting everyone that's involved
yeah,
with that. Yeah.
yeah, yeah. So it's happened a couple of times, but I think the majority of times that I've been involved, the family have been definitely on board.
Mm. One word that comes to mind when I think about palliative care is dignity. So dignity for the patient, dignity in their journey towards end of life. For the more junior nurses out there that are listening, how can they foster dignity within their care provision for their clients?
It's listening and learning about the person that they're looking after,
Mm.
and truly listening. So all the things that you learn in nursing school about tasks and it's when you're nursing someone, it's about listening to them and actually learning who they are as a person. I think that gives people dignity and not making them think that they're not important or they're not they shouldn't be cared for. It happens particularly in public hospitals that are really busy, or all hospitals are really busy, but that it becomes tasks. You go in and give your IV antibiotics and then you come back with the medications and you don't have that time to really get to know your person that you're looking after. And I think that's giving people dignity, is really knowing who they are and where they've come from and a little bit about themselves. I love learning about people that I look after. Yeah.
Yeah. Human behaviour is really interesting. It's probably one of the things I remember doing social psychology at matric and working with, human behaviour and how people react to certain different situations. And I see nurses as a conduit to keep that safe advocacy health profile there while managing so many different personalities. I had John Rosenberg, we recorded his podcast last week. You may know him as a palliative care research academic up here at the Sunshine Coast Uni. And we spent a bit of time on the podcast talking about compassion across nursing. What do you see as some of the ways that we can let's take it away from the patients, but look at nurses themselves. How can we foster compassion within our nursing workforce, do you feel?
I think it starts with being compassionate about yourself as a nurse. If Because I think a lot of nurses that go into, particularly into palliative care, can get compassion burnout because you're giving so much to your patients and your families that you're looking after. And I've been burnt out several times, and it's very hard to recognise. So it's about filling your own cup, I believe. And I think you need to have things outside nursing that you can fill your own cup so that you are able to be compassionate to the patients and to their families. I don't know whether I answered that correctly, but that's where I was going with that.
It's to do with self-care, isn't it?
Absolutely.
And I had Michelle Gordon as well talking about this, and she's a burnout specialist. That self-care for nurses is something that is so important. And when you're tied up giving so much to your profession, that's often, and my first book, Midlife Mojo, talks about that all the time. It talks about, at some point in your life, you've got to stop and you've got to really reflect and look at everything and have a balanced view. Looking after yourself is paramount. So let's talk about where you're currently working at the moment.
Yep.
And how did that came to be? Because I know from personal, conversations with you in the past that you were very tenacious and wanting to get this nurse practitioner role, so much so that you basically chased it down. Tell us a little bit about how that came to be, because it's inspiring for other nurses that are feeling a bit stuck.
Yeah. I once I'd made up my mind that this is what I wanted to do, I just kept asking, how do I do this? I was asking the right questions, but the people that I was working with, and it wasn't with I was working with you, were shutting it down. They were just saying, there isn't any positions to do candidacy, and you don't. Why do you want to do it? There was a lot of, especially from doctors, there was a lot of, why would you want to be a nurse practitioner? Are you trying to sort of take my job? It was really hard to get a foot in the door. And I think that was mainly because the positions that I was working in, I was good at my job, and I don't think people wanted me to go on and do something else. That's what I think anyway. So when I did come back down to Victoria, and funny thing is, I actually got a job when I was driving back down. So I was driving back down from Queensland to come back to Victoria, and I rang about a job when I was on the road about Dubbo, and had an interview on the phone as I'm driving down, and landed myself a role as a palliative care nurse in community in central Victoria in the country. And as soon as I landed, I went and had a face-to-face interview, started there. But I still had this issue that I wanted to be a nurse practitioner. So I started asking everyone again, and I was just knocking on doors, and no one really wanted me. I didn't have a lot of experience back in Victoria, and everyone was saying no, no, no. So I ended up doing some work with Palliative Care Consortium. So the consortiums are sort of like the governing body over palliative care services. And I actually got to know the chairperson there, and the CEO, and just kept asking and asking, and I ended up going for a scholarship. So the scholarship was really just to pay for my uni. So then I had to find mentors. So that was another knocking on doors thing, but I just kept at it until someone said yes. In hindsight, I had two mentors, and they were both doctors. They're both palliative care doctors. And in hindsight, I probably should have had a nurse practitioner or a nurse to be my mentor. But I had really great mentors, and it was a hard slog. It was a really hard slog to try and get the clinical assessments done and things like that, because you have to be supervised in your clinical practice, and there's a lot to do. But anyway, I got there in the end. So
that's the good news. That's the good news.
Exactly.
Yeah, I don't know whether you're aware, but I did 2 years out of a 3-year program to become a nurse practitioner in oncology post-treatment care. So looking at supporting patients after treatment to prevent them from going back into hospital. And the goalpost shifted. So when I started that program, I had everything set up. It was all supported, et cetera, et cetera. But into the latter part of the second year, the support was withdrawn because the priorities of the healthcare service took precedence. So I can understand the frustration that you have this dream or aspiration to do this, and there seemed to be a lot of resistance towards encroaching into that field. And I think it's better now. And you're right that like the scholarships back then, they were encouraging expert nurses to enter those fields, and even shoulder tapped to be able to do those roles. But one of the things that I wrote in my third book was around the infrastructure behind these positions. If it is a strategic direction, then all of the nuts and bolts in an ideal world should be worked out first, and have a list of mentors that you can call on in various different areas.
Well, I also developed my own strategic plan when I was trying to get this going, and I did a business case. I put it to the organisation that I was working with, and when I got my scholarship, I got a contract with the organisation I was working with to say that if I did this course within the 3 years, and obviously became endorsed, that I would have a role as a nurse practitioner for 2 years at that organisation. But 6 weeks before I finished, they withdrew that contract and said that they couldn't afford to put on a nurse practitioner. So I was without a job 6 weeks before I became endorsed. So there was still barriers there. I was very lucky that I was able to get a job where I am now. But yeah, it was I think it's because there's not a real support for nurse practitioners in Australia. There's only 2,500 odd nurse practitioners in Australia, and not to put anyone off, but 600 of those nurse practitioners are not working in nurse practitioner roles.
Yes.
So it's about growing, and this is what I'm very passionate about now, it's about growing the nurse practitioner workforce because they're so important, especially in regional and rural areas, and encouraging people still to get that clinical experience and still become nurse practitioners. But it's about getting the organisations to actually recognise how important nurse practitioners are to the healthcare workforce and making positions for them. So, yeah, a lot of people I know have gone through candidacy positions and not had a job at the end. And it's really disheartening when you put all that work in.
Yeah. Yes, or they're actually employed in other roles where the nurse practitioner skills that they've trained for is really eroded, like their competency in that role is not best utilised for the service that they're working for. So what do you see as one of the key things that nurse practitioners can achieve in their roles?
I think it's a more holistic care because we can go that one, we've got that clinical expertise obviously to do assessment, but we can go that one step further by being able to refer to other specialists, being able to order diagnostics, being able to diagnose, which nurses aren't allowed to diagnose, but nurse practitioners can diagnose, and also to put a treatment plan in place. The difference between a nurse practitioner and a medical practitioner doing that is that you have that nursing care as well. So my interactions with people might last an hour and a half, where I do a thorough assessment. I'm talking to families, I'm talking about advanced care planning, all of those extra things. And I think it's more accessible than you getting a 20-minute consult with a very busy doctor. And so I think it's more holistic care that we can achieve as nurse practitioners, and it's also more accessible, so it's more equitable across regional and rural Australia particularly.
Nice. And I think the patients and the families are to a degree more comfortable talking to nurses about everything.
I actually get called a doctor a lot by the patients.
Yes.
And I think it's because, I bring the stethoscope out and they automatically think I'm a doctor, but I'll always say, no, I'm a nurse. And I think that puts them at ease, that they can actually tell me everything.
Yes, yes. So if I was to produce a magic wand over the nursing profession, in your experience, what is the one key thing that you would like to see changed for nurses?
I actually thought about this before you asked me, but I think I'm going to change my mind. I think it's by having more leadership roles, because I think the nurses that are coming out are put into really high situations that are very difficult and to navigate, and they don't get that support that they should be getting. I know that when we trained, we were put on wards in our second year of nursing, but I think now you're churning out of university and chucked into these roles, and it's quite confronting and not having that support. So I think there probably needs to be more education and support for not just graduate nurses, but new nurses in the beginning of their career. And then also encouraging them to do leadership roles as well, and not make that a bad thing. So, I see, particularly in aged care, that nurses are thrown into roles as an ANUM, for example, without any experience and no support at all. And they just burn out and hate nursing because they just can't do the things that they have been taught to do. So there's no time. So I think more support for new nurses, not just graduate nurses.
No.
Not everyone gets a graduate year anyway. So I don't know how to do that, but I think we don't support our nurses enough.
Yes, I agree. And the burnout rate it's shocking to hear that 1 in every 3 nurses have thought about leaving the profession
Mm,
because of exit, the
mm,
stress, the burnout,
mm.
the expectations, which is really sad. So
Yeah.
what one piece of advice would you give to the nurses that are listening today or
Mhm.
watching? Mm,
Keep going,
mm,
just keep going. And um, every day is a different day. Nursing is a fantastic career.
mm.
It's something that it changes all the time. You learn so much, you can give so much. It's a great career. So on those days that you think that you might want to be a nurse, give yourself a break and just get back up and keep going. And if it is something you do want to aspire to be, for example, a nurse practitioner, just keep trying. Look at me, I'm an oldie and I can still I was able to get my dream. So there's always hope that you can get where you want to go. It's a
Yep.
great career. Mm,
Keep knocking on those doors.
absolutely.
Great. Well, it's been fantastic talking with you today, Sandy. Thank you so much for taking half an hour out of your afternoon today to be with us.
Problem at all. It was
Yeah,
great.
beautiful. All right, everyone, that's our episode for your Nurse Voice Matters. We look forward to talking with you on our next episode. Bye for now.